Initially, this video was supposed to be about questions that you may receive in your interview for a medical billing job. But then I thought about it and I was like, the two jobs that I had, the interviewing questions that they gave me were really bad questions. They really didn't have anything to do or to figure out my skills as a medical biller. Now, that was good for me because that was at a time when I was new to billing. I didn't really know much, and it was good because they hired me to do the job. But I think right at this point now that I know so much about billing, that they should have asked me different questions than what they asked me. And so I thought what would be more beneficial is if I can give you questions to ask in a medical billing interview. So it doesn't matter if they ask you good questions or bad questions. These are questions that you can ask. So remember in the last video that I did, I spoke about making sure that you have questions when you get into the actual interview. So today's video, I'm going to let you know some questions that you can ask in a medical billing interview. So keep watching. So one of the questions that I would ask first and foremost is, what specialty would I be billing for? Now, these questions are good for whether you are going into a interview for a 9-to-5 job, or you have your own billing company, or you're doing like a side hustle for billing and you are like having a consultation or you're interviewing a provider. So these questions are not just for 9-to-5 jobs. These questions are overall. And I kind of did like general questions that you can ask in every interview. But remember that if they say something, you might have to go further into questioning. So I can't do all of that because I don't know exactly what would be said in the interview. But these are just general questions you should ask. Knowing what specialty you would be billing for is important to you because you might not want to bill for that specialty. Again, I had told you in the last visit that you should research the company that you're interviewing for, and maybe online you notice that they are family practice. That's what it says online. But when you get into the interview, if you ask this question, they might let you know that they also do integrative medicine, or they also do pain management, or something else. Providers don't always just do one specialty. They can do several specialties if they choose to do so. So you as a biller would need to know what specialties they bill for. Now imagine if you had a job as a biller before and it was in pain medicine and you totally hated it. So now you've gone to this family practice interview and then you find out that they actually do pain medicine as well. You might not want to take the job, and you have the right to do that. But if you didn't ask the question about which specialty that they bill for, then you wouldn't know. So first and foremost, find out what specialties you will be billing for. Then the next question that I really think is important is, what software will I be using? And is this an EMR and a practice management system? Now, I specify that you need to be clear to them. You need to say clearly, is it an EMR, meaning your medical records, or is it a practice management system where you can send out claims, do all of that stuff? I have had several situations, and I think this is why I'm stressing it so much, because there have been several times when I've asked the provider, so do you have your own software? Do you have your own system? And they're like, yeah, sure, I do. Da, 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 da. And then when I get in or I go to look and see what they're doing, it's just an EMR. It's not a practice management system. Now, for us as billers, it's very important that you have a practice management system, because that's where you'll actually be able to send out the claims through. There are some EMRs that you can send out claims, but because they're not geared towards, dealing with the revenue and claims and all of that stuff, it's kind of wonky. Like, I've dealt with one like where it was just an EMR and you could actually maybe put in post payments and, send out claims. But like I said, it was just really wonky, and I had to do extra steps because, again, it's not geared towards actually being a practice management system. So it doesn't have all the features that a practice management system would have. So I would make sure that I ask them, what software do they have? Which software would I be billing out of? This will also determine how you will be billing, because maybe you might have to do a few extra steps because they don't have a EMR. Maybe they're using paper charts and they have a practice management. So now the information cannot link from the EMR because there is none. So if there's a paper chart, you'll have to make sure you enter. Maybe we'll be doing a lot of data entry from the chart to the practice management system. So I hope that made sense. But you just need to find out for yourself so you can know how much work you'll have to do on your part as a biller. Then you would want to know if the practice collects co-pays, co-insurances, and deductibles up front. Now, if you don't know what those three things are, you can watch this video right here, and I go into a little bit more depth about what they are. I also have a video that is all about deductibles, so I'll also link that above. But I think this question is important because although you're not the one who would probably have to actually collect the co-pays, the co-insurances, and the deductibles, you will be the one on the back end dealing with that through patient statements if they don't collect it up front. So if for some reason the practice has a problem collecting these, co-pays, co-insurances, and deductibles up front, on the back end, it may be a problem for you because patients don't like to come into the office, be told that they don't have anything to pay, and then on the back end get a statement. I always recommend that you collect the payments up front at the time of the visit because you will be able to collect more that way. Having to collect on the back end, sending out statements, you're wasting time, you're wasting paper, you're wasting money to send out these statements when you could have collected it, especially if you knew what it was on the front end. So as a biller, if you're interviewing for the billing position, you would want to know that because that's going to be probably going to be a part of your duties that you need to do as far as patient statements and maybe even calling patients. And you want to know if there's a problem with that and maybe if they need to change that so there wouldn't be so many patient statements that you would have to send out or make so many calls to patients to collect money. Now, this fourth one is a very important one as well. And I would ask them, what does your AR look like for patients and for insurances? And is it over 90 days? So especially if you are billing in the office, I would like to find out how much past stuff will I have to deal with. So if I'm going into a new office and this office has $100,000 in aging over 90, I know that I have my work cut out for me. As far as for my business, that is a separate service for me. So that's not included in my billing service. So the providers may or may not want me to do that. They may let their old biller, clean up the mess that they made. And then I would just deal with anything that I've done from the point that we signed a contract on. But when you work in an office, most likely they're not going to do that. If they have let go a biller, then they hire you, you're going to have to clean up all of the stuff that was happening before. So I would say just ask them, how does their AR look so that you can know what you may and may not have to do in the long run. If you don't know what AR is and what I'm speaking about, I will link that video that I have speaking about AR in healthcare, because as a biller, that is one of the most important things that you would have to deal with as far as following up on claims that haven't been paid. So make sure you check out that video if you need a little bit more information on AR. And then piggybacking off of the ARs, I would ask them, do you have a problem with rejections and denials? So again, the denials are or should be the main thing that's on the AR report. But when it comes to rejections, you want to know if they have a problem with certain rejections. Maybe the front desk is not putting in the information correctly. And so when it goes through the clearinghouse, they have a lot of rejections on the back end. Now, remember, there are clearinghouse rejections and insurance rejections. And if you don't know what that is, I'll link the video for that above. But as a biller, you will have to deal with the rejections. Now, rejections are usually not that hard to correct or fix, so it may not take up a lot of time, but it will take up time. So you're going to have to probably do a little bit of investigating, figuring out this, that, and the third, and it's going to take up your time. So don't forget to like the video and comment below, especially if these interviewing questions are some that you may use in your next interview as a medical biller. Also, remember to watch to the end because we have like 5 more plus a bonus, so you don't want to miss out on those. And I just wanted to remind you that March 28th is Medical Billers Day. So make sure you get your medical billing merch at www.medicalbillingmaven.com. We have t-shirts, if you can see. We have pillows. I have cups, mugs, lots of different t-shirts with lots of different sayings on them. So make sure you represent for us medical billers. So be sure to check out my store. I have the link below in the description, and I'll put it again on the screen. Now, the next question I would ask them is, who does your medical coding? That question is one that probably doesn't get asked a lot, but let me tell you why that question is important. Now, you can be getting hired as a medical biller and they expect you to do coding. That is very, very common, especially in small practices. So I would make sure I ask who does the coding. They might say the provider does the coding. And then I can follow up with that, like, so are you expecting me to do a little bit of coding? Is he going to do all the coding? Like, I would ask these questions because, again, you may think they understand the difference between a biller and a coder, and a lot of them don't. Unfortunately, a lot of them don't. Unfortunately, a lot of people don't understand the difference between billing and coding. And this is one of the reasons why I have this channel, because I don't care how many times I say I'm a biller, they will always come back with, oh, so you know what code da 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 is, and you know what, and I would have to tell them again, billing is sending out the claims and following up on claims until they get paid. Coding is actually being able to read the notes and choosing the right codes. I've noticed that some providers don't necessarily want you to do that, but they want you to assist in coding. And I don't have a problem assisting in coding because I am also a certified coder. But I don't market myself like that because I don't really want to code and I don't like coding. I want to do the billing portion of it. But you may want to do coding and that may be fine for you. Or you may just not want to do coding at all and you just want to do the billing. And that question then piggybacks on to this next question, which is, what are the duties that I'm responsible for, and am I the sole medical biller? So what duties I am responsible for could kind of go into, again, if they decide they want you to do coding or not. Am I going to be just sending out claims and maybe doing rejections? Am I going to be actually payment posting and doing AR? Like, what are all the duties that I'm responsible for? In smaller practices, again, you will probably have to do from the submission of claims all the way to the end to patient statements. In bigger practices, you may have like a specific set duty. Now, for me, I prefer being the end-to-end biller. I like to do from the start of claim submission all the way to the end of patient statements. There are some people who don't like to do that. They just want to stick and do one thing, post payments. I find that very boring, tedious, I guess, because it's so mundane. Like, I just would prefer to do the end-to-end billing, do a little bit of everything, so I know how to deal with all the parts of the billing. So just ask them, what duties do they expect you to do, and are you the only one doing that? Because if you're not the only biller, they may have it where one biller is doing certain parts of the billing and then you're doing the other. Or they may have it where you're still an end-to-end biller, but you just have a specific account. So you only deal with this account. And that happens a lot when you work for a medical billing company because they have different clients. So they might want you to have control over certain accounts. So ask all of those questions because that's important for you to know when it's time for you to work. And if you don't know what the duties of a medical biller is, check out this video, and I hope I have enough cards to link all of these videos I'm talking about. But if you don't know what the duties are, then you can check out the video that I'll link, or I'll at least put it in the description box so that you can know what to expect or what they would expect of you in the position of a biller. So the next question I would ask is, what payers are you credentialed with and what payers would you like to be credentialed with? So in this case, I would ask this question because, certain commercial payers or even government payers, Medicaid, Medicare, especially if they take Medicare, Medicare has a whole lot of different advantage plans that can get confusing. You may or may not want to deal with all of those different types of insurances. Again, you have to remember that you can decide whether or not you want to work with these people or you don't want to work with them. So asking these questions will give you a feel of what working with them would be like and help you decide whether or not you want to work with them or not. So let's say you interview for a practice that only deals with patients that have workers' comp. Yeah, I have not dealt with workers' comp in years, but I remember they were the worst. And I actually don't want to deal with workers' comp again. Also, another one that was kind of bad for me in the Virgin Islands was veterans or VA, as you say it. And they were bad as well. I heard that they got a little bit better, but especially in the Virgin Islands, let me say that. I don't know if anywhere else is different, but there's certain insurances you may or may not want to deal with. Now, if you're new at this and you really don't know, that might not be too much of a concern for you, but it may. So I would ask, which payers are you credentialed with and which payers you want to be credentialed with. I would also ask that last question because some providers think that you would be responsible to credential them with these payers that they want to be credentialed with. Some may have their office manager do it, or they may do it themselves. But I have found that there are a lot of others who feel, well, you do the billing, you should know what to do. And credentialing and billing are two separately different things. Now, I know this because I have been put in that position where I had to credential providers. Initially, I was kind of scared and I was like, why you have me? I don't know what to do. But I'm glad that I did it because it wasn't as hard as I thought. But it is a learning curve and you kind of have to know what you're doing to get providers credentialed. So asking that question is important for you to do because then you can, like I said, make a decision. Then there is, how many patients do you see in a day, maybe in a week, or in a month? And this is important for you to ask them because, again, if they see, 30, 40, 50 patients in a day, that is, if they see 50 patients in a day and they're there for 5 days a week, that's 250 patients in the week. And that's, maybe around 250 patients that you have to send out claim for. And, your agent will probably be higher. Your patient statements will be higher. Like, there will be so much work for you to probably do, is maybe especially if it's just one of you, all of those things you have to keep in mind. So depending on how much patients that they see, that will determine maybe your workload, how much you'll have to do, what they're expecting of you, how soon they expect you to get it out and stuff like that. So I would ask them how many patients do they see in a day. And I would kind of leave it to a day, not necessarily a week or a month, because then they start to get, to me, too lax. And they'd be like, oh, well, I only see like 100 patients in a month. Come to find out, they see 200 patients in a month. So I kind of more ask them how much patients they see in a day because I think they have a better view of how many patients they see in a day. And then one of the last questions I would ask them would be, what problems are they having with their billing currently? Again, this would help me as a biller figure out what I have to deal with or what I'm coming into. If you're coming into a hot mess of the situation and you just love fixing up and cleaning up practices, then that might be good for you. But if you don't like that and you just realize that, this is a hot mess of a situation, I don't want to have to deal with it, then you will be able to say, well, no, I don't want the position or whatever it is. So I would just ask them, what specifically are they looking for? And I would also ask them that because it would then also help me if I decide to take the position. I know that they have problems with, I don't know, rejections and denials. Then I can make sure that I focus in and work on that. So in a 3 months time, in a 6 months time, when I go back to them and we have our meetings and we, they try to figure out what I've done in that time, I can make sure I address the situations or the problems that they had initially and show them where I helped them. Initially when I started out, y'all had a problem with your agent. It was over 100,000 for 90, and now I got it down to 40,000. They like to hear about numbers and figures, and they want to see how you are helping them. So knowing what they feel the problem is. Now, the problem may be something completely different, but what they feel the problem is initially when they're hiring you and being able to fix that, in a couple months, that will get you kudo points. And here is my bonus question. Always, 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 I feel you should always, this is my personal opinion, you need to ask what you will be getting paid. Now, there's a caveat to that, I guess I should say. That is not your first question in the interview. When I get in an interview or when I'm interviewing someone and the first question they ask me is how much they're getting paid, that is really a complete turnoff. Now, mind you, some of the jobs have how much they will be paid in like the paper or the posting or whatever. But there are a lot that don't. So you might be going into a job not knowing how much it's paying you. But you should know how much you're going to be paid at the end of that interview. And this is to help you determine, again, whether or not you want to take the job. You don't have to take the job. So if you get into a job and they're offering you $12 an hour and you think that is crappy money, then don't take it. You need to know that though before you actually get into the job. You don't wait until they call you and then they offer you the job and you take it, you sign contracts, and then when you get your first paycheck, you realize that you're not getting paid what you thought you was going to get paid. There are too many people that I know like that who have no idea some of them don't even know the title that their job title. They don't even know the job title that they're applying for. That is crazy. You need to know at the end of your interview how much you're getting paid. And this is going a little bit off topic, but that even helps you with, on your end with your pay and your money, because you want to know how much you're getting paid to know if it's enough to sustain you, if it's enough to pay all your bills. And you want to know that. You don't want to figure that out after the fact. You don't want to assume that you're gonna get paid a lot because it's billing, because for some reason a lot of people feel that you get paid so much money as a biller, and so you might quit a job that you had and gone to do billing and then find out that they pay you pennies. And sometimes they do pay you pennies, unfortunately. So that's my bonus question that you should ask. Do not leave that interview without finding out how much you're going to get paid. So if some of these questions are foreign to you and you have no idea why you should be asking these questions, then make sure you check out this playlist right here. It's talking about the revenue cycle in healthcare for patients, and it goes through all the steps of the revenue cycle so you can know what questions you should be asking when you are in a medical billing interview. I'll see you in my next video.